Hello and welcome to the Meet Me in Africa podcast. I'm Colin Taylor, a Fellow of the Royal Geographical Society. This episode is a direct sequel to the last one about Kenya. On this episode, I have Dr. Daniel Magnus, a consultant in Paediatric Emergency Medicine. He is a trustee and co-founder of the charity COP, Kenyan Orphan Project, which is now child.org. We first met briefly in Kisumu in western Kenya in the summer of 2005 on the trip when I recorded the conversations that appeared in the last episode of this podcast. Here, I take a step back with Dan to talk about the last 25 years of his involvement with the charity and visiting Kenya. You'll hear him explain about the evolution of the charity and the type of projects, the partners and fundraising activities, including Dan talk about his experiences cycling in Kenya through Ride Africa, the fundraising event. I started off by asking how his connection with Kenya came about.
Welcome. The story way back when, for when it all began, really, story in some ways about a medical student in our year at Nottingham, whose name was, and thankfully still is, Hezron Makabewa. And he grew up in Western Kenya and ended up, through a series of events, being a medical student in Nottingham in the Midlands. And when Becky and myself were first talking about doing something or starting a project of some kind, or, and as these things often, do start in the very beginnings, it was kind of quite organic and not very well thought out. Organic is probably the cleverer sounding version of not very well thought out. But when we were talking about doing something, and really our focus at that point was around children, and in particular around a really burdensome HIV and AIDS epidemic that was really exploding at that time. It was sort of 2000, 2001. It was Hezron who we first came into contact with, and he started talking to us about Kenya, about the HIV problem in Western Kenya specifically, and then the sort of introduction to Western Kenya and to Kenya as a whole kind of came from there, really.
Okay, you were at medical school between which years?
So we started as medical students in Nottingham in 1998. And we graduated in 2003. And so the beginning of what at that time started as COP and is now child.org was 2001. And so in fact we're kind of looking forward to 2026 now as the kind of 25th anniversary year of a lot of that stuff.
Okay, so leading up to 2001 then, three of you by the sound of it, you kind of put your heads together, and then what, how did you actually get over there and start doing things?
Yeah, so Hezron, he also had a kind of work colleague, a guy called Joshua Odongo, who was living and working out there and in London. Actually, was kind of in between countries in terms of the work that he was doing. And he was involved in a community-based organization in Kisumu at that time that was doing a lot of work with widows and orphans. And the project that they were just getting going at that time, or were about to try and launch, was a project turning an old hotel into a special hospital and clinic that would specifically try to support children and HIV orphans. That was the real focus. And so we sat down with Hezron and Joshua, and they said, well, look, why don't you set up a group in Nottingham and help us fundraise for this project? And actually, if you felt like it, you could actually come out and see what we're doing there. And what do you think? And so Becky, myself, he's now Becky's husband, Reston, was involved at that time as well. We kind of sat down and said, well, why don't we get a group of medical students together to focus on this project, to fundraise to support this project, to learn about, the HIV and AIDS epidemic, to learn about what health and child health looks like in a low resource country. And in this case, it would be Kenya. And the more we kind of got into that, the more we thought, well, let's fundraise for it, but also let's take a group of students out to help with that project as well. And you can't see it very well, actually, but that picture up there It's the first group picture of that exact group of students.
Oh, wow.
In that first summer. So 2001, we were doing fundraising activities and kind of launched the group in Nottingham, COP, Kenyan Orphan Project, as it was called at that time. And then 2002 was the first summer that we took a group of 25, 26-ish students out to Kisumu. And that then set the ball rolling for more project support, different projects, more student groups, including Reading, Colin, which was how we kind of first came into contact with each other. So that was the kind of birth of it, if you like.
Yeah, brilliant. And so that was Port Florence, was it?
And that was Port Florence, yeah. The sort of historical name for Kisumu at one point was Port Florence during kind of colonial times. And so, yes, the name of the hospital was the Port Florence Community Hospital. Yeah.
Okay. And then you sort of went back to your studies and started gearing up, I guess, quite quickly, gave you loads of ideas for the following years.
My recollection, and, these things always look great on paper, don't they? But in reality, sometimes, they're much more organic than you sort of recall. But, I think what happened was that, so Nottingham sent a group of students out and we fundraised in that first year. And then I think even just by year 2, I think there were students from, I think it might have been Reading and Cardiff that we were already starting to engage through, medical student X, new medical student Y, and we could set up a group in our medical school because that, and so actually reasonably quickly, but in truth, not by design at the very beginning, quite quickly, within 2 or 3 years, I think we had 5 or 6 medical schools who were raising money to support specific projects. It was Port Florence Hospital at the beginning, I think Kochogo Secondary School and Primary School, and some of the feeding centres for children that we were starting to support. That the support for those projects all grew quite quickly with a model that at the time felt okay to us, and I think we were really keen to sort of marshal it closely, which was about sending students out there, a model that worked well. And I think was done responsibly at the time, Colin. We were really careful about safety and exposure for the UK students. We were also extremely mindful of the impact that those students were having in actually visiting. What was the point of them being there? And, how much of this was kind of, what later became called voluntourism and that sort of thing. And I think even at that time, we were very conscious of that and put lots of safeguards in place, not just from a UK perspective, but working closely with Hezron and with Joshua and with our Kenyan partners to make sure that it was appropriate. So we put a lot of effort into doing that. But I think it's probably fair to say, and lots of time has gone by there, that the 2002, 2003 model of students going out to do that work by 2012, 2015, maybe. I'm slightly picking numbers there, but 10 years on, I think there was probably an understanding that actually that was becoming a less sustainable and less appropriate way to support health or child health and education programs. But I think for the time that we did it in, and it was a hugely important time, I think, for our Kenyan partners, for the groups that we were working with in Kenya, for UK students and other, UK groups. I think it's something I look back on with a lot of fondness, really.
Yeah, definitely. So then, being a busy medical student, lot with going on with your studies, but around that, you managed to actually set up the charity COP at the time.
Yeah, that's right. So in 2002, 2001, 2002 is when it kind of started. In 2003, I went to Kenya for 3 months, actually, or just under 3 months for my elective. That's you probably know, Colin, or people listening might know, but that's still the term referred to as the opportunity where medical students, before they graduate or around the time of graduation, have to go overseas to do some work. It doesn't have to be overseas, actually, but to do some work somewhere to kind of supplement their medical training. And Owain, who came on that very first group, Owain Evans, he's now an orthopaedic surgeon in Sheffield, paediatric orthopedic surgeon. He and I went to Kisumu for just under 3 months to work in the district hospital there, but also to work on COP projects. And that was the time that Becky and I kind of started to really focus on registering the charity as a kind of bona fide organisation.
Yeah.
not least because we were actually at that point starting to put quite large sums of money through what was just a club and society account for the charitable work we were doing there. And I think we felt a lot of responsibility to make sure that the governance and the accountability around that was really watertight. So it was somewhere around 2003, 2005 is when we started the process of trying to register. And I think we finally registered properly. I think it was in about 2005. Somewhere around that time, and there was no coincidence about that date, because actually 2004, 2005 is when Owain and I went back to Kenya again for an even longer period of time. We were living there for 6 months at that time, again, kind of undertaking work in Kisumu. Again, some of it medical work, some of it kind of project related work.
Yeah, wow. So, yeah, it's obviously come a long way in those sort of 20, 25 years. The other thing I just wondered if you could explain, Dan, was the kind of perhaps slightly complicated network of different organisations. So you mentioned Joshua, there's Omega Foundation, I understand, obviously COP, Widows and Orphans International, and also the journey from COP to child.org. So,
So that, I mean, it can look quite complicated, and in some ways has been quite complicated, and in other ways is quite a nice story of the evolution of organisations working together, I think. So right at the beginning, I guess you would say that in some ways COP really was a kind of UK-based group of enthusiastic people wanting to support community-based organisations on the ground in Kisumu doing the delivery, in truth.
Yeah.
So Omega Foundation, OGRA were two big CBOs, community-based organisations working in Kisumu, collaboratively but on discrete projects. And Widows and Orphans International was a UK-based charity that was funding some of those groups. So Joshua, for example, was the founder of Widows and Orphans International based in London. He was also the founder and chairperson of the Omega Foundation working in Kisumu. Hezron had a sort of UK presence, but was the founder of the OGRA Foundation. And so we, with great pleasure, actually kind of were supporters of those community-based organizations delivering projects, whether that was the construction and maintenance of primary and secondary education facilities, health clinics, street children centres, those kind of projects that were running in Kisumu. And we were enthusiastic in participating in supporting all of those. And I think that was the right thing to do and was done appropriately in the early stages of COP as it was there. What transpired over those early years, Colin, certainly after about 5 or 6 years, probably that kind of time frame, was I think just a sense, particularly around the time that we became registered, that actually increasingly the kind of governance and accountability that we wanted was best served by us actually as a registered UK charity, deciding what our objectives were as a charity, not what other people told us we should do.
Yeah.
I guess, in terms of development models early on, if we were honest, we would be saying, well, okay, we've got some money. Hezron and Josh, what is it that the CBOs that you're running in Kisumu, what do you need? What are the projects that need support? And we would support those projects. And I think it was done well in many ways. But I think we transitioned to a version of the charity that we wanted to be running that really said, well, actually, what is it that with our partners needs to be done? And how can that be done most appropriately? Not least, I think, because of sort of, governance, really, making sure that we had financially watertight mechanisms, that we had good accountability, that we had reporting. And I think what happened over a 10-year period or so was that we did good work in Kisumu with those project partners, but that over that time, including some, things that we had to learn the hard way, some, projects that weren't delivered quite in the way that we had anticipated that they would be delivered, funding models that actually we felt weren't that sustainable overall. Even a couple of examples of, money going missing. I remember there was a really sad occasion where we had been supporting a discrete piece of work with the Street Children Centre in Kisumu with Omega Foundation, and the funds went missing because there was a member of staff who was just not a good person, not from Omega, but from the actual Street Children's Centre itself. And I think those things happen, and I think donors and humans understand that sometimes those things happen. And really, the question is how you respond to that, and how we're honest about that, and how the governance structures around that work. And I think we felt that in the early days we didn't have quite enough control over that. And so as we moved to a registered charity with a real responsibility, not just to the donors, but to the people we're trying to support, that we needed to just be really clear about what our objectives were as a charity and who we were working with. And so over time, that transition, we completed a number of projects in and around Kisumu, and then that kind of evolved to supporting projects in other parts of the country, to a focus on newborn health, to new project partners in other parts of the country. And then as we evolved into Child.org, which was really a kind of branding exercise in some ways, we developed new project partnerships, new ways of working, focus on working with ministries of health to look at more sustainable projects, more sustainable focus in terms of newborn health and the health of mothers. And so that's not to say we would never work back in Kisumu or Western Kenya again. In fact, personally, I would love to do that actually. But as things stand at the moment, we're working in 3 or 4 counties in Kenya now at district health and government level, I think serving the needs and working with 10,000 plus mums and their babies, and the sort of journey that the charity has been on has been really inspiring.
It is. And I was lucky enough to come along to an event in April to hear some of that firsthand, and hear from some of the Kenyans that were over visiting, Cherio and Ruth, talking about the work over there. Perhaps just, again, rewinding a little bit, but just talking about how you've resourced up as the charity. So, you were describing there back in 2003-05, it was you, Becky, Owain, Hezron, sort of doing things around your studies, embarking upon your medical careers, but at the same time building up the charity. Sort of how did that kind of start? What did it look like 20 odd years ago? And, what's the growth in personnel been, I suppose?
Yeah, that's a really insightful question, Colin, actually. I mean, a kind of watershed moment for us, I think, as an organization was a piece of funding that came to us, or that we were lucky enough to receive, probably around 2006-07, I would say it was. And it was a piece of funding that was really unique, actually, because the group that agreed to fund us said, look, we actually want to invest in your capacity as an organization. We're hugely passionate about the projects that you're trying to support on the ground in Kenya, but actually we're willing to invest in the growth of you as a charity. And that was huge for us, because that was the moment that we were actually able to employ 2 people at the start. That was it. It was a kind of director of the charity and somebody to be the kind of student program coordinator at the time, as it was, plus to allow us the breathing space to really develop those mechanisms for governance and for efficiency and for finance and for sustainability. And that really kind of marked the start of our kind of modern journey, if you like. And from there, then we were not only able to grow, the UK sort of staffing and structures of the charity, but importantly then subsequently the Kenyan base. What is inspiring and wonderful for us now is that actually we have fabulous, capable, inspiring and energetic staff members in the UK driving forward everything that Child.org is doing in the UK. But the office in Nairobi, where Cherio and Ruth and Chege and Marty, who's obviously runs the whole charity now, the work that they do there kind of really driving forward, and not just the growth of Child.org, but, what are we actually doing to support mothers and babies and to improve newborn health and to contextualize, the challenges facing mothers and children in Kenya right now. Their focus on that is just amazing. And, and is obviously, we're hugely privileged to be able to do that, which back in 2003 or whatever, when like you say, when we were trying to do it around studies or as a newly qualified doctor, that was always going to be a real challenge.
Just sort of moving on a bit from the work of the charity, but in terms of the fundraising, so talk there about moving away from the student projects But now, the fundraising efforts, the ride experiences, the Charity Concierge, and as a keen cyclist myself, I'm very interested in your experiences. So, Dan, tell me a bit about Ride, the experience through child.org, one of your flagship fundraising events. What is that? And a little bit of a sales pitch for it, I suppose.
Yeah, well, right. Let's talk about Ride briefly, just by in and of itself, because it is a pretty amazing thing. So, way back when, I think it was 2009, probably 2008, 2009, we were just thinking about a fundraising event of some kind, and I thought it would be interesting to do a sort of sponsored bike ride in Kenya from Nairobi to Kisumu. We were still working in Kisumu at that time, along what used to be the old railway line, which actually it is sort of running now, but at that time it wasn't. And so, and it certainly wasn't just me, but I was enthusiastic about it. We very lucky to at that time already to be developing some really great corporate partnerships with a number of our really keen supporters, and one of them in particular, a company called Festival Republic, and their chief executive and founder came together with us and said, "Yeah, let's do that." And so that first year it was a sort of slightly kind of amateurish version, but we rode across Kenya, a big group of us, and raised lots of money in the process. What happened subsequent to that was the evolution of what is now Ride Africa, where we have, I can't even remember how many we've done now, but every 2 years we've come up with a new route. Most recently in November, we took 70 people, including Kenyan colleagues and partners, and cycled, a big route around Kenya, and we've sort of mixed that up over the years. But it's a week of great cycling, fabulous friendships, incredible scenery, and really kind of, life-changing experience. But underpinning that is a very clear focus on, a concerted fundraising effort to really kind of pump, prime, and support the most important work that Child.org is engaged with. And, in the November just gone, we raised, just over £200,000.
Wow.
And that is a serious amount of money that we can say in a very clear way, it's going to these projects to support antenatal health, improve the survival of newborn babies, work with local partners in delivering better healthcare for mums and babies. And so, Ride Africa has become a really fabulous kind of string in our bow, if you like, but also represents a kind of patchwork approach to fundraising the projects that we're engaged with, that include, important fundraising by normal people doing normal things. Colin, I'd count you and I and many of the people listening to this as normal people just trying to do something important, all the way through to, super complicated grant proposals and, institutional funding that we're still trying to acquire, and that the Child.org staff do a great job in trying to acquire. But, the landscape is complicated. I won't need to preach to anybody about, what a challenging time it is geopolitically and in terms of the cuts in aid and funding through the UK government. So it is really hard going out there to find institutional funding, whether it's academic or non-governmental funding or governmental funding. But the efforts and the passion that the supporters of Child.org have shown, all the way back to the very first COP volunteers, like you, Colin, really, and I'm not trying to embarrass you, that is what has driven the charity forward in its own way over those years. And it's something that we still rely on. And if you're listening to this and are kind of interested, check us out, speak to us, come and be part of our kind of extended family, if you like. It is not a coincidence that on the bike ride in November just gone, we were celebrating, the 4th ride, 5th ride, 6th ride, even the 7th ride for many of the riders who are coming back time and time again.
Wow. Yeah. So I think Charity Concierge, you mentioned Festival Republic, one of your other fundraising activities. It involves, I think, volunteers going to festivals and doing quite a cushy job by the sound of it.
Colin, I don't know that they would say, I don't think the concierges would say that's cushy, but that said tongue in cheek. Yeah, I think it's a great example. Festival Republic have been just an astonishing supporter of ours from very early days, actually, in terms of, not just financing or helping to support projects on the ground, all the way back to the very first street children's centre in Kisumu. In fact, the first residential facilities that enabled street children to actually have a roof over their head and sleep somewhere safe in Kisumu, that was funded almost totally by Festival Republic, actually, through us and in collaboration with our project partners there, who did most of the really hard work. But Festival Republic have been an amazing supporter, and they're very intimately involved with many of the biggest UK festivals. And so as a kind of really good example of quite innovative fundraising and collaboration and partnership, we're in the privileged position now of being able to send volunteers to work for child.org as charity concierges, is what they're called, who will go to a number of the festivals and basically provide services for festival goers, like carrying gear or putting up tents or, those sorts of things. And obviously in doing so, the festivals donate funds through to child.org, and our volunteers work quite hard, I would say, Colin. But also have a reasonably cushy and an incredibly fun time at the festivals. But again, I would encourage people to have a look at that, because we're always looking for volunteers, and it's a really successful project.
Yeah, and just to say, obviously check out child.org on the socials. I think they're pretty active at the moment. Been to Latitude last week.
That's right.
Glastonbury, I saw them there a few weeks ago. It's obviously a busy time of the year for all of that. So the other thing, just Dan, your reflections on, I know you've talked a little bit about it already, but how things have changed sort of out in Kenya over the last 25 years. Sort of have the challenges particularly changed? You mentioned the HIV/AIDS crisis that kind of was the initial, thing you were looking at over there. But has that changed? Is there other things? Your focus as a charity. You talked about helping mothers. Even I heard recently helping dads now to.
That's right.
Yeah.
Yeah, I mean, it's sort of hard to answer that question without all of us starting to feel a bit old, isn't it, Colin? 25 years on from when we started, because obviously, I was a medical student at the time, and I'm now a consultant in Paediatric Emergency Medicine and have been for quite a long time now. And the world, of course, has changed in that time. So, and I guess that's something good for us all to reflect on, that the global health story is it's a good news story, not just in Kenya and not just related to child.org, but actually the progress in child health, not just in the mortality of children dying under the age of 5 globally, for example, but in all markers, that there have been real gains in maternal and child health. The catastrophe in HIV/AIDS that was unfolding around 2001 when we started all of this, it's unrecognizable now. At that time, people did not have access to antiretroviral drugs for HIV/AIDS, and deaths were soaring. That has really changed. I'm not saying that it's not a huge problem still, but it looks different. Similarly, the actual progress overall in child survival, in infectious disease, in water sanitation, in all sorts of metrics has improved. So that's good for us to reflect on, because it means that things do work. Investment in global health, in non-governmental organizations, in charities, in programs to support the most vulnerable members of our communities, wherever we live, they help and they do work. And that has been the same in Kenya. So overall, the metrics in Kenya have improved hugely in the last 25 years. The disappointing thing, and one of the things that we need to remain mindful of, is that the inequality still is a problem. So whilst overall, Kenya is now classed as a middle income country, there are still areas within the country that are still facing huge challenges. And so, if you look, for example, at things like child mortality overall in the country, or teenage pregnancy overall in the country, or maternal deaths during childbirth overall in Kenya, actually not doing too badly. But within the country, there are still hotspots of real need. And that's where we're able to be agile enough to work with local government and other local partners to kind of target those areas. So, Kenya has come on a long way. After the bike ride in November, I spent a couple of nights in Nairobi, and I was, coffee shops and internet hubs, and it's modern city doing incredible things. So our old narratives about what Kenya might feel like, have moved on considerably, but there is still considerable need. Same in our country, to be honest.
Yeah.
And so there's a good news story there, but we also just have evolved and need to continue to evolve in targeting and supporting need. where it exists, and and being conscious of the areas of need that we're not targeting either. So traditionally we've not been a charity that has focused on humanitarian disasters or conflict, for example, but sadly in 2025 some of the real pinch points around child health, including in the vicinity of Kenya, up on the borders with Sudan and in some of the more dry parts of the country, and thinking about climate change, and so there are evolving needs that I would like for Child.org to be responsive to, and I know that our staff are focused on that, and Marty and the senior leadership team within the charity are focused on that, and it'll be interesting. If we're still around, God willing, Colin, in 10, 15 years' time, to talk about, what the next 10 to 15 years have looked like. And I expect it will be different in a positive way, hopefully. But, you just never know what's around the corner.
Yeah. Well, exactly. Also just interested how you work with other charities, across the whole scale, sort of UNICEF, any other charities that come to mind, and how you kind of, you've obviously set your stall out, you've got your objectives as a charity, but, the relationships, how does that work?
Yeah, I mean, we, right back from the beginning, the objective in our mind was never to set up a charity for the sake of it. In fact, obviously we have the luxury as people with medical jobs in the NHS, we always had that luxury, that we were fine and we had jobs.
Yeah.
But, we'd be happy in some ways, in principle, for everything to become so great that Child.org becomes obsolete and nobody needs us anymore. I mean, I think that would be a great objective, actually. I don't think we're that close to that happening, but in principle, that's the case. So, looking at other charities and what they're doing has always been important to us. And we don't want to start doing something that somebody else is doing perfectly. That's just repetition and no need. We're not trying to generate just more charitable work for the sake of it. So we've always been quite focused on trying to do things that either nobody else is doing or trying to do things better than anybody else is doing, acknowledging that we are still relatively small charity. We don't compare in any way to the likes of Oxfam or Save the Children or international corporations like UNICEF, for example. That said, working with academic partners, other NGOs, and in particular in Kenya on the ground, other charities or groups that are doing work that we can add value to or complement has always been something we've been keen to do. And Marty and the team have done that a lot, actually, with some of the antenatal work that we've been doing, looking at other groups that have been working on antenatal care, and same for newborn care. I think what will be interesting moving forward actually is the role of UNICEF and some of those bigger organizations, because they can feel quite distanced from us. But the sort of bridge there is some of the governmental groups, and we just need to be consistent in working with local government wherever possible to deliver the agenda for health or for education or whatever it might be that fits within a kind of governmental context. And if working with UNICEF or big international agencies in that capacity is something that we can do usefully, then we'll always do that.
Yeah. A question taking us back to Kisumu. So when we went out there, obviously we were introduced to Martin and Vincent, our brilliant guides that became great friends very quickly. They were working as VMAR, the VMAR Foundation. Just wondering, can you think back sort of how that worked through, sort of what happened to that? You mentioned that the Sunday kind of street children feeding, did that sort of merge into your work or did it move on?
Yeah, so that's a sort of, that's got a very kind of personal place in my heart, really, as an anecdote. So when we were living out there in 2005 was when the Omega Foundation and OGRA were sort of working together, I think, as I recall, in supporting the HOVIC was the name of the kind of group that became responsible for trying to support street children in central Kisumu. In fact, I think HOVIC, once it started as a kind of Omega project, became in its own right a registered community-based organisation for supporting street children. And in its early stages, that's when the sort of feeding sessions, this is also difficult language, isn't it? But yeah, in a sense, they were intermittent weekly opportunities for street children to come somewhere safe for at least one cooked meal that was safe and secure and reliable a week. And the HOVIC were engaged in doing that, and we were helping to support some of that in the early stages. Around that time, Vincent and Martin, who were initially engaged with the COP student program, like you say, as kind of guides and kind of minders almost, through Hezron and Josh at the beginning, they, and I think they would, Martin posthumously, obviously, we'll talk about him in a second, but I think Vincent would be okay with me saying that I think they were kind of quite moved by everything they saw through Joshua and Hezron and through the student program, and then felt kind of empowered to address some of that need in their own community and in their own circles. And so Vincent and Martin, off their own back with their own money, started providing support to orphans and vulnerable children in their own community, providing support with accommodation, with education, financial support, that kind of thing. And so to formalize that, they wanted to start their own community-based organization in the area that they were living around Kisumu, in a place called Kondele. And they formed Vima whilst in fact, we helped them to try and register it as a CBO when we were there. And because, the interesting story is they wanted to call it Vima because of Vincent and Martin, but the local authorities wouldn't allow them to use that name because they didn't like it. They felt it wasn't appropriate to use their names. And so actually then became Vijana Marufu, is the Swahili for youth empowerment, which is what then became the name Vima.
Right, okay.
And so we, as an organization, actually worked with them for a while to support the children in that program, as you like. And actually, latterly, what happened, and it was, it wasn't easy, actually. It caused me a bit of pain personally. But I think there was a view from the trustee board that we had done some good work in supporting Vima, but that actually sustainably and in terms of a long-term strategy for supporting children and young people, that actually that didn't feel like the right way to do it for a combination of reasons. And so we kind of finished supporting the children that we were helping to support through Vima, and then we kind of wound down our involvement with them. In relation to what we were talking about 10 minutes ago or so about looking at the right way to support projects in the right way. Of course, in and around that, unfortunately, Martin became very ill and sadly died at a very young age. And that was a huge loss that we all found, that we all felt very profoundly. Yeah, none more so than me. I spent a long time when we were living there in their world. Martin used to take me training in their gym every weekend. And some of my fondest, earliest memories of being in Kisumu, of learning Luo language, of learning about the city, of learning about Kenya with Becky and also with Owain, were in Vincent and Martin's company. I will forever treasure those memories and have huge love in my heart for both of them.
Yeah, absolutely.